Breast enhancement procedures are common, yet immense skill is required to achieve a natural result. If you want the most beautiful breasts for your body type, it's important to have your questions answered by an expert. Join Dr. Armando Soto for an informative session on breast surgery and your complimentary consultation on Wednesday, October the 5th. Listen as Dr. Soto answers some frequently asked questions when it comes to breast enhancement procedures. What will my breasts feel like after surgery?
That's it. Here's the thing, that's going to depend a lot on the consistency and texture of your own breast tissue, how much skin you have, and it's also going to depend a lot on what type of implant we put in you. So, in other words, saline implants can often tend in women who have a very small amount of their own breast tissue to feel a little bit firm or a little bit like a water balloon under the skin, which is not ideal. Now, if a patient has more breast tissue available of their own to camouflage the implant, then a saline implant might feel a lot more natural. Silicone implants usually feel very natural, very soft, very warm, a lot more like a real breast than a saline implant does. So from the perspective of the feel of the breast, the silicone implant is usually superior, especially the smaller your breasts are.
Okay. How long after surgery should I wait before I can get back to my spin class and regular exercise routine?
Well, upper body exercise is not allowed at all for a few weeks after surgery, depending on your surgeon's preferences. I usually, if we're putting implants under the muscle, I usually don't like my patients to do upper body exercise for the first 4 to 6 weeks, depending on how they're doing when they come to see me. Now, if you're on a recumbent bike where you're not really leaning forward and bearing weight on your arms, you can go back to that a little bit sooner. But usually I won't want you doing upper body muscular exercise for a few weeks.
Why do you recommend breast implants under the muscle?
There's a lot of reasons that I think it's in the patient's best interest to have the implants placed under the muscle. Honestly, putting them on top of the muscle is a lot easier for me. It's less work. I can do the operation faster. The downside is that the implants won't look as natural, so there's a cosmetic compromise that they don't feel as nice because you can feel them through the skin and the tissues. But the worst part is that because they're on top of the muscle and the only thing holding the weight of the implant is the skin and the thin connective tissue of the breast tissue, is that over time the breast will end up looking like you have a bowling ball in a pillowcase. And no woman likes that, and that can be difficult to fix after the fact. So it's usually a lot better from a cosmetic point of view to put them under the muscle, but there are also long-term risks that are lowered if the implants are under the muscle, such as the risk of them becoming hard, the risk of mammograms not being as well done or as careful as if the implant is under the muscle.
To have these and other important questions answered by a board-certified plastic surgeon, call today to schedule your reservation.